Is it possible to avoid or reverse the side effects that are caused by cholesterol-lowering therapies? The short answer is yes, but there's more to it. First, let me share with you what are some of the most common side effects. They include muscle pain and weakness and overall weakness and fatigue, increased risk for diabetes and digestive problems, and cognitive and mental function problems like memory loss and depression. I see that often in the people I help in my practice. These men and women start aging much faster when they start taking cholesterol-lowering medications. To avoid or reverse these side effects, it's important to understand, why do these side effects occur to begin with? What is it about cholesterol-lowering medications that cause these side effects? And that has to do with the functions of cholesterol. The answer lies in the fact that cholesterol is an important substance for the human body. It is needed to keep you in good health and functioning well. In fact, it is so important that 85% of the cholesterol in your body is made from within, and only a small portion comes from your diet. So if you're going to artificially reduce the amount of a substance that your body needs for good health, then it makes sense that you'll start experiencing poor health, that you may experience the type of side effects that I mentioned earlier. So, for example, more specifically, cholesterol is used for the production of important hormones, steroid hormones, hormones that regulate immune function, or hormones that increase your ability to withstand stress. Cholesterol is also needed for the production of bile and bile acids, a substance that is important for the absorption of certain nutrients and for the detoxification of toxins from the liver. It is also needed for the production of brain and nerve cells. It is present in every single cell, where it actually acts to hold cells in place so they don't collapse on themselves. And it is important for the production of energy so we can live and function optimally. So now that you know this, do some of the side effects that I mentioned earlier make more sense to you? Things like weakness, fatigue, and poor brain function. So now that you know how important cholesterol is, what are you to do when your doctor wants you to get on cholesterol-lowering medications to decrease elevated cholesterol in order to try to help you prevent a heart attack or a stroke? Check out my previous video about the topic, where I talk about the relationship between cholesterol and cardiovascular disease and how some studies actually question that. You can ask for tests that determine the amount of inflammation in your arteries, in your blood vessels, and tests that determine the extent to which your blood is clotting. High inflammation in the arteries and high clotting activity is closely linked to increased risk for cardiovascular disease. In fact, it is just as important, if not more important, than just checking cholesterol levels. If inflammation in the arteries is high, then it's a sign that plaque is likely being laid down and blockages are built and created. If cholesterol is high, but inflammation is down and the clotting activity is down, then your risk for a cardiovascular event is likely relatively low. If you do end up taking cholesterol-lowering medications, ask your doctor about supplementing with a substance called coenzyme Q10. It's a substance that is naturally made in your body, and it plays various roles in energy generation. There's a lot of it in your heart, in your muscles, in your brain, kidneys, and liver. And cholesterol-lowering medications tend to reduce coenzyme Q10 levels in your body. The thing about coenzyme Q10 is that it is highly protective for the heart. Studies have shown that coenzyme Q10 has a significant protective effect on the heart. The ultimate way of dealing with high cholesterol is to find out what actually causes it to increase and then deal with that. There are several causes other than dietary factors that are not very well known, and this is the topic of the next video.